So we are going to be doing 3 tests today. We are going to be doing Clunk1, Clunk2, and Crank test. So for all 3, I'm going to have my patient laying here in the supine position. I'm going to be, for the first one, Clunk1, I'm going to be having his elbow in 90 degrees of abduction. I'm going to be applying force into the elbow medially on my belt buckle area, and I'm going to be circumducting the head of his shoulder here with my hand. So I'm going to grasp it and make clockwise and counterclockwise movements. We're going to adjust a little bit just so you guys can see a little better. So again, applying that force into him, grasping as close to the humeral head as I can, and applying that circumduction. So that is indicative of a Bankart lesion. Then we are in the perfect chance to go into our Clunk2 test. So again, I'm going to be in this position, applying that load into him. One hand is going to be palpating, acting as our fulcrum on the posterior aspect of the humeral head. I'm going to be grabbing his arm here, and I'm going to be clunking at about every 30 minutes if this was an hour clock, all the way up to about 160 degrees. I'm looking for any pain clicking with that. That will be indicative of a labral, anterior or inferior labral tear. And finally, for crank test, when I have him at the end of this 160 degrees about of shoulder abduction, I'm then going to have him here, again, grasping his distal humerus and his radius and ulna. Now I'm going to externally rotate him and internally rotate him. And so I'm looking for any pain with that or clicking, which is indicative of a slap tear.